Hello, everyone. This is Craig Hackett. Once again, I'm working with Seneca to present um, this class. So if you're a little confused as who I am, go back and look at the introductory videos. I just want to go briefly over the history of health and wellness. This is Unit 1, Topic 1. So you can follow along with the PowerPoints, or you can listen through this and watch along, and then review your notes as well. And if you have any other questions, please feel free to contact myself or Seneca, depending on who your instructor is this semester, and they'll answer the questions. We use the same slides, so it shouldn't be too confusing, hopefully for you. Just real quick, we're going to go a brief history of what health is. Back in the 1800s, the definition of health was pretty simple. It was the opposite of sick. The pictures on the screen there are there for a reason. If you'll look, that's a surgery. And you can see that the poor lighting, you have people in there without masks. There's smoke in the air. So there was very little concern about microbes and things that maybe infect us um, from our environment. So that was one big thing. The picture on the bottom is something important to watch for, because I'm going to show this picture in progression um, throughout the next 3 or 4 slides. So that big building with the pointy steeple is Trinity Church, and that's a picture of New York City. New York City, Trinity was the biggest building in the city for a very long time. And if you'll notice there, not many awnings on the street. The streets are dirt. There's animals in the street, things like that. So there, environmentally, there just wasn't a lot of good care going on. If you see the bullet points here, some pretty remarkable, ideas of medicine. Doctors were really more about, the art of it and not a lot of science. And a lot of the medicines that they used were herbal, and some of them were quite dangerous, including mercury. Dr. Rush, who was around when Lewis and Clark, you know, uh, went on their adventure to discover a Northwest Passage, gave them pills called Rush pills, and one of the main ingredients of the Rush pills was mercury. They obviously didn't take those pills because it just killed you slow. So pretty dangerous stuff in the 1800s. And as we progressed into the late 1800s, here's a picture of that same street. You can see Trinity Church way out there in the background. Now you see awnings, and the streets have been cobbled. So they started to understand a little bit about sanitation. Those awnings aren't to shade people. Those awnings are for when people were emptying their their urine and feces during the night in their chamber pots. They would dump it out their window and onto the street. So you had awnings to protect pedestrians walking on the streets from people dumping their waste out their window. So still not a great environment to live in. This is why disease was pretty rampant back then. But but because of different things, and I want you to think about what occurred in the late 1800s and the early 1900s to kind of speed the idea of health and healthy practices along, and kind of think about that. Um, and in class, you might want to discuss it in your discussion boards of what might some of those things have been going on that kind of encouraged the practice of good health. Women's health was very poor back then. Not that they were poor or of poor health, but doctors just didn't treat them for a couple of those reasons there on the screen. So here's some of your top diseases of the 18th century. And if you look on the left, those top diseases, a lot of those we don't even worry about anymore, like chickenpox and smallpox and measles, tuberculosis, whooping cough. We have vaccines for those now that most kids, if they get vaccinated, they don't even get those kind of things. We still deal with the flu because the flu changes all the time, but it wasn't one of the top 3 causes of death. Influenza is still on there. The flu is still on that list even today, but it's like ninth. We still have a lot of third world countries out there that have a tough time with vaccinations and just keeping people hydrated when they do have the flu and they're throwing up and diarrhea and things like that. And that's usually what kills them, is the dehydration. So influenza used to be in the top 3, now is in the top 10, just because of so many people in the world. Child and mortality rates, 40% in kids under 5. So that was, so you had 4 in 10 chance of dying when you were a kid in the 1800s. So in the 20th century, because of better practices, we were able to practice medicine. I'm hoping you were thinking a little bit about my question before, and I'll give you a little hint. It had to do with war. We had the Civil War, we had the Spanish American and World War One. So we had a few wars that we got to practice some medicine with, and we got better at techniques. Our technology improved. We're able to diagnose better than we ever did before. So medically we got better. Sanitation-wise, we got better. We started to use copper pipes, and copper as an antiseptic, believe it or not. So when water runs through the copper pipe, it tends to clean some of the microbes out of the water. Not all of them, but a majority. Doorknobs, things like that were made out of copper for that reason back in the day. We don't do that quite as much as we used to because we have better sanitation techniques, but our pipes that run water are still made out of copper for that reason. Now today, our definition refers more to our body function and social health. So we're going to talk a lot about that in this course, not just our ability to feed ourselves and to exercise and do things to improve our body function, but also the things that we need to do to have good social health, which decreases stress and increases our positive outlook on life. And believe it or not, that has a huge impact on our health, even our physical health. So our social, and that includes mental health, has a big, huge impact on how we feel physically. So I need to talk quickly about some definitions. You have mortality, which you can read on there, and morbidity. And I want you to understand how that works in the process, especially this last few months with COVID-19. So basically, the incidence is the new cases coming in to the prevalence pool, or how many cases we already have. So let's talk about COVID-19. In early March, we had, let's just say, I don't know the exact numbers, let's say a couple hundred cases, and they were in the Northwest, and we had a few in New York. The government started to worry about if we overwhelmed our healthcare, so they wanted to turn down the nozzle of the incident rate. So basically, we wanted to slow down how many people got sick. That's incidence. So they told us to stop going to school and stay home and socially isolate and stay 6 feet apart, wear masks. Because what they didn't want is to fill up that prevalence pool so much so that we couldn't handle it within our hospitals. There's two ways to leave that prevalence pool. You can die, which is what we call mortality, or you can get better and you can leave the prevalence pool. And what they don't want to do is have a reoccurrence rate. And that's the big concern right now with COVID, is that it'll change just a little bit. We won't have a vaccine, and people who might have antibodies or protection from it may have a reoccurrence of their illness. So it kind of explains that picture there. And that we do that with all kinds of stuff. That's why we have vaccines. We want to decrease the incident rate of the flu so that we don't have a big prevalence of the flu. We do that with chicken pox. We do that with all kinds of stuff. And that's why we cover our mouths when we sneeze. By covering our mouth, we decrease the incidence rates so our prevalence pool doesn't increase. So hopefully that's pretty clear. If you have any questions on that part, please send a text or an email to me or to Seneca, and we can try to explain that a little bit better. So there's three types of ways to prevent disease. The first one, most important, and kind of talked about it, is the primary. You stop it before it happens. And the second one, obviously you can read that there, is you're going to recognize they have symptoms and then intervene to either slow it down or to stop that problem. And then if you have the disease or the habit that's going to cause the disease, like smoking or drinking, then you can get treatment or rehab for that. So that's really important. So remember that. What we're trying to do with this health class and most education is to give people background knowledge or a foundational knowledge so that they can use that primary means of preventing disease before you get sick or before you're so sick that you need to have some sort of treatment or rehab. So we want to stop it before it starts, and that's the primary. So there is an organization called healthypeople.gov, and it was 2020. They've now moved it to 2030, and 10 years from now, they'll move it again. And they have a vision. They want to help society achieve their full potential of health. So they're going to try to protect and come up with programs and treat people so that they have every opportunity to be as healthy as they can. You can see the website down there. We encourage you to visit that website. They have tons of information on different types of disease and prevention methods and things like that. So healthypeople.gov is a really good website to check out on any topic that you can think of when it comes to health. Mental health, physical health, social health, you name it, it's on there. So some of the programs that they do are educational programs to facilitate learning, like it's mentioned there. That's why we do this class. They provide data for governments to look at to say, hey, these food programs or these voucher programs are helping, and this is how much they're helping. So that's like free or reduced lunch and things like that. So there's lots of different programs, and you'll see that on that website. So you can check it out there, and you can also go to the Arizona websites. And they'll lead you. They'll have a link to your specific state. So here's some of the 10 public achievements that they accomplished in the 20th century. This is the last 10 to 15 years. So we've had vaccines that have increased. We've gotten better understanding of vaccines and kind of dispelled some of the wrong ideas of what vaccines are doing. And you can read the list there. So all of these are things that healthypeople.gov in accordance with and in cooperation with the WHO, World Health Organization, and state, local, and federal governments to try to help provide people with a healthier ability to live a healthier life. So that's what they were doing. So there's still some things that they're trying to do. We're still trying to prepare people for better health, and it really comes down to individual choice. So we're going to go over a lot of that in this class too. Some of the things that you can do and to be healthier and to encourage other people to live healthier lifestyles. Okay, so that finishes it up, and I hope if you guys have any questions, please let us know. And I know this was quick, but you take the time and go back over the notes and do a little research on your own, and let us know if you have any questions, and good luck with the assignments and the discussions.